Some pearls regarding soft tissue lesions. Any tissue lesion, soft tissue lesion, which is deep into the deep fascia, is suspected to be malignant. Number two, any lesion which is more than 5 centimeter and deep is suspected to be a malignant lesion. Anything which is painful has high suspicion of malignancy. Anything which is increasing in size is suspicion of malignancy. And anything which is loculated or cystic, suspicion of malignancy. Risk factor can be chemical like asbestos, viral infection like Epstein-Barr virus, herpes simplex virus, irradiation, or genetic cause. The guideline states that if MRI is diagnosis, the mass is benign and symptomatic, can be removed without biopsy. If MRI is indeterminate or suggestive of sarcoma, a core or open biopsy is done before further treatment.